Hello students, today we will discuss about some important causes of large gut diarrhea. First of all, inflammatory bowel disease, which include ulcerative colitis. Then Crohn's disease, as we know that Crohn's disease can affect any part from mouth to anus, so it can be also cause of large gut diarrhea other than small gut diarrhea. Then after that, CA colon, then irritable bowel syndrome, then amoebiasis, after that pseudomembranous colitis and microscopic colitis. So first of all, we'll discuss about ulcerative colitis because Crohn's disease has already been discussed in lecture of small gut diarrhea. Ulcerative colitis is also inflammatory disease or ulcerative disease of large gut, as the name is indicating, and its cause is not known. But this ulcerative colitis, in comparison to Crohn's disease, is that inflammation here is superficial, while in Crohn's disease, whole thickness gut wall is inflamed, and there are through and through ulcers in case of Crohn's disease, while here in ulcerative colitis there are superficial ulcers. Then after that, strictures and fistulas, they are more common in case of Crohn's disease, while in ulcerative colitis they are not common. So it is a superficial disease, and here only large gut is involved, while in Crohn's disease any part of the gut right from mouth to anus is involved. Then on histology we see that in Crohn's disease there are non-caseating granulomas. However, the complication of ulcerative colitis, they are quite grave. It can lead to toxic megacolon, and it can also lead to CA colon. Now, after that, we will discuss that what are the symptoms of ulcerative colitis. It can cause abdominal pain, anorexia, weight loss, of course, bloody diarrhea, which is of large gut characteristic, that is small in amount, may contain mucus and contains blood. Then there are certain extra-intestinal manifestations which are present in both ulcerative colitis and Crohn's disease. They, starting from the eyes, they can be episcleritis, scleritis, keratoconjunctivitis sicca, which is dryness of eyes, uveitis. Then after that, liver involvement, that is primary sclerosing cholangitis, can be part and parcel of ulcerative colitis. Then kidney stones, then skin lesions, including pyoderma gangrenosum, which is a sort of ulcerative condition of skin, and this ulcer has got a specific sort of purplish edge which is overhanging. So these are few extraintestinal manifestations of ulcerative colitis. Then we'll talk about the severity of ulcerative colitis, that how do we judge that this ulcerative colitis is mild, moderate or severe. Definitely we assess it with the help of frequency of stools. If it is less than 4 with no abdominal pain or fever, then it is mild, and if it is between 4 to 6 with some fever and abdominal pain, it is moderate, and if it is greater than 6 associated with abdominal pain, fever and fatigue, then it is severe. Then after that comes toxic megacolon. Here the colon, it becomes enlarged and dilated, so much so that patient develops hemodynamic compromise, and he starts running high grade fever, and his abdomen gets very, very tender. So this complication is called toxic megacolon, and it can lead to perforation. And this is the X-ray of the toxic megacolon, where you can see that megacolon is enlarged to such an extent that it can perforate. So first of all, we try to treat it with the IV methylprednisolone, but if it is not treated, then we have to go for the surgery, decompressive surgery. Then after that is the treatment of the stable ulcerative colitis. If it is proctitis, mild to moderate, we give only suppositories or topical aminosalicylic acid. But if it is not controlled within 4 weeks, then we can give oral aminosalicylic acid along with topical. And if it still is not controlled, we wait for another 4 weeks, then we start topical steroids. And in the last, we can add oral steroids as well. But in refractory cases of ulcerative colitis, where other than rectum, other parts of the large gut, they are also involved, we can give patient azathioprine and anti-tumor necrotic factor therapies, which are actually the biological agents. And then, of course, there is also role of surgery. So this was the brief description about ulcerative colitis. Thank you very much.